Thanks. Thanks for that introduction. I'm not really sure how I transitioned from that incredibly emotional performance to a relatively academic, intellectual talk about payment. So I'm not going to try, but that was incredible. Thank you so much for that performance. Since I have a microphone, I can say that. That was really, really inspirational. So not to transition, but to talk what I'm supposed to talk here about. At Spire, as Nicole was mentioning, we've been really focused on how do we scale these technologies? How do these technologies impact not just the people in this room and the communities here, but the billions of people around the world that we can really impact? And I was just thinking about the fact that it's somehow particularly relevant today. A lot of us here, folks I've talked to in my office, have been talking about the pollution that's in the air today from the fire, and we've all seen that. But here's the thing: the dog agrees; it doesn't like breathing this air. Here's the thing that's hard to imagine: the air quality outside right now is bad. I think people would agree with that. The PM 2.5, which is the particulate matter that's dangerous in the air, I just looked this up, is 77. Normally it's between 0 and 10. It's 77. Today in Beijing, it's 264. In Delhi, it's 284. The reality is 90% of the world's population breathes polluted air, and a few billion people, about 2 billion people, this quality of air is the norm, not the anomaly. So, that as you can see, it's just the things we're doing to our bodies are incredible. And the impact of breathing air, as you'll learn, I'm a bit of a respiratory health nerd, is not just impact on the chronic respiratory system and respiratory diseases, but also on mental health and mental well-being. There's a lot of studies that tie anxiety, stress, the ability to make decisions to our ability to breathe clean air, and a lot of us are not. So how do we have a big impact with that? And as Nicole mentioned, with Spire, we started with a consumer product called Spire Stone that we released a couple of years ago. And we were the first company, the first product to bring a mindfulness biofeedback breathing product into Apple stores globally. And so that product has been sold in Apple stores for the last few years around the world, which was really cool because it introduced hundreds of thousands of customers of ours that otherwise really were unaware that these kinds of technology existed. By going into that Apple store, they became aware of it and purchased our product, and we're able to drive some really great outcomes that I'll talk about here from that. But the reality is, as we learned, being in the consumer electronics space still really limits the impact that you can have. The sad fact is the vast majority of the population, both in this country and then globally, do not have the income, the discretionary income, to walk into a retail establishment and spend $150 on a product like this. What they do spend money on, because they have to, or because they need to, and because our government provides it to some extent, fortunately, is healthcare. And our belief is that for these technologies to really have a big impact, we've got to integrate into the healthcare system. And the good news, which I'm going to talk about today, that was a preamble, sorry, to get to the main thing, is over the last couple of months, there has been a massive, massive transformation in terms of federal policy that allows technologies like Spire, our devices and others here, to actually start integrating into healthcare. So this is a bit of a in-the-weeds policy talk, but I hope you find it interesting because I believe what I'm about to talk to you about is going to have the biggest impact on this space that we've seen in the last number of years. So I'm going to skip that. So how do you get what in the medical context is called remote patient monitoring, which is sensors on the human body, physiological monitoring. And yes, they can do a lot more than that, but that is the medical term, so that's what I'm going to use. How do you get remote patient monitoring into the broader healthcare space? It's something that's been talked about for a very, very long time. Why hasn't it happened? 2 reasons. Number one, there's been no method for reimbursement. If doctors in the room are nodding their heads, everyone else might be a little bit confused. Unfortunately, the way our healthcare system works in much of the world is that if there is not what is called a reimbursement code, a CPT code, tied to a device or a procedure, doctors cannot do it. And that's not because they don't want to do it. It's not because they don't believe It's not a good thing for their patients. It's because the system we have, it's not viable to providing care outside of billable codes. And so for any kind of technology, any kind of new practice, any kind of new procedure to get into the healthcare space by providers being able to do that, you have to have reimbursement codes that are billable by the doctors or by the providers. The other thing is that when you start looking at who are the most in-need populations, it's chronic disease patients. So if there's anyone with a chronic disease, that can be anything from heart failure, which is probably quite widely known, or diabetes, COPD, asthma, anxiety. There's a very wide range of chronic diseases that more than half Americans are living with on a day-to-day basis and makes up the vast majority of our healthcare spend, about $4 trillion. Products are not designed for those patients. So I want to talk about the solution to both of those. The first one has nothing to do with us, but it's a transformation that's happened in the market literally in the last 2 months, and actually quite literally as of last Friday. And the second one is something we've been working on a lot. So reimbursement codes, the huge news, and if you're in the device space, this is all in my view that matters over the last 2 months, is that Medicare in 2019 is going to reimburse for remote patient monitoring. And what this means, so Medicare, whoever knows, for those who are not from the US, Medicare is the insurance that our government provides to people over mostly to people over 65. It's federally funded. Despite all the debate about Obamacare and private health care in the company, the biggest payer, the biggest health insurance company in the United States is the government. It is Medicare. It is relatively effective. And if you're in healthcare policy, what you know is that Medicare, believe it or not, is actually tends to be what determines what the private healthcare insurance do. So new codes tend to come out on Medicare first and then are driven down into private healthcare like UnitedHealthcare or Blue Cross Blue Shield. And so Medicare is starting to reimburse remote patient monitoring in 2019. There's 3 codes. These are the temporary codes on Friday, so just a couple days ago, or last Friday, I guess, a week ago, they released the final Federal Register, and they confirmed that these 3 codes are in there. They're going to pay physician groups, providers, so not just the doctor and nurses, a one-time $21 to set someone up on a remote patient monitoring technology, which is great now that there's a reimbursement code for actually getting someone set up. They're going to pay $69 a month for the actual technology itself that's providing the kind of feedback, and they're going to provide $54 for the qualified healthcare professional, meaning a nurse or a doctor, to review this data and to interact with the patient off of this data. Look at the data, talk to the patient about what does that data mean and how it might impact their point of care. Big disclaimer, I'm not a lawyer. Please don't take this for legal advice. But this is really, really, for all of us who've been in this space, I've been working on this for 7 years, this is what we've been waiting for. It means that we can now go to our partners in the healthcare ecosystem, pulmonologists, primary care providers, what have you, and start deploying these technologies, and it fits within their workflow. So it's very much in the weed. I know these codes are kind of weird, but we do believe this is the transformation this industry has been waiting for. So that's on the reimbursement side. I can't take any credit for this, but it's really, really exciting. The final registers for this were released by the federal government on Friday, a week ago. So that's one part of it. The second part is, how do we build products that can really be used in a chronic condition management setting and by physicians? And there's a couple issues that we think the kind of first generation of wearable devices and sensors have faced. The first one is that the friction around the sensors is really high. You've got to remember to charge them quite frequently. You have to remember to wear it and put it on. They're visible, which when you're sick is not something you necessarily want. They're uncomfortable. And so the result has been that the adherence on these devices has been very, very low. The reality is when you look at the broad market, those who are highly engaged in wearing sensors fall into 2 categories. One is those that are highly motivated. Maybe it's for fitness reasons. Maybe it's because the device can create, like our first product, Spire Stone did, create immediate feedback for someone. When you have a chronic disease, you're not motivated. You're not motivated to work. You don't want to wake up in the morning and think, oh, I'm sick. Great, I get to put this on. It's not how people think. So that's, that's a super key thing. The second part of it is that the value of the data has been relatively low from a healthcare context, right? You've got to get a wide variety of physiological signals to be predictive and to create real health impact on various chronic diseases. And the second one is devices, this is more on the medical device side, have been fairly narrow scoped in solution. So 4 years ago, we looked at this and said, can we solve these issues? Can we rethink how remote patient monitoring works and solve for these issues? Take everything we learned from Spire and get into this. And what we came up with was Spire Health Tag. This has been on the market for about 2 months now. Spire Health Tag just completely rethinks the whole way that remote patient monitoring works. So how do we do that? Well, first of all, you don't get one device. You get a whole bunch of these devices. So this is a device right here. It's just this tiny little tag. You get a whole bunch of these. We sell them in packs. You stick them onto the clothing you wear most often. So one thing that everyone does, or almost everyone does, is wear clothes. It's a behavior that already exists, regardless of whether you're a patient or healthy or what have you. So we said, well, if you want to wear something, you should really just be wearing your clothes. So you stick it on your clothes. And this is an important thing. You've probably seen a lot of kind of smart clothing. I've got to be honest, I don't believe in like smart shirts and stuff like this because we all wear different clothing. The reality is, Apple, the biggest consumer electronic company in the world, sells really less than 100 SKUs of products. Nike, the largest apparel manufacturer in the world, they sell hundreds of thousands of different SKUs of products. Not everyone wears the same clothing. So we said, let's make these little tags and put it onto the clothing you already have. Whatever clothing it is that you wear, that you enjoy wearing. So you stick them on the clothes, and then that's it. You literally don't have to think about them ever again. And you're probably thinking, well, there's probably some influence in that. The first thing is you don't have to charge them. The battery lasts up to 2 years. So once it's on your clothes, you're never thinking about plugging this in again. The second thing is it goes to the washer and dryer. So again, once it's on the clothes, you're not thinking about it again. I've been wearing these now for quite a while, and I never have thought about the device. I just wear my clothes, and that's it. And so that's been really transformative. Just some of the tech features, because I know this is a pretty tech-savvy crowd. There's 3 core sensors on this device. The first one is our proprietary respiratory sensor. If you've known Spire before, our core technologies around, our sensor technologies around respiratory sensing, we're able to get a number of different respiratory parameters. There's a actigraphy sensor in there, and then we've added an optical heart rate sensor where we're able to get really good heart rate and HRV data. So you're getting this kind of complete health tech data, and you're just simply not thinking about it. And the results of that are great. It works. We've run a study looking at adherence with patients. Ship them 8 tags. 12 months later, 95% of them are still engaged, are still adherent. We're still collecting data from it. If you know this space, this is, someone down here has just mentioned this really good. This is really, really good. Just as a reference point, Genentech down the road makes cancer drugs. You would think very high adherence. They only have about an 80% adherence on people taking cancer drugs, oncology. It's incredible. So this is just really great. And it kind of makes sense because literally you don't have to do anything to be adherent to this product. Just simply put on your clothes. So this is really key. And to go back to how this relates to the remote patient monitoring codes, if you're a doctor and you're going to spend time getting someone set up on this technology, and most patients are not particularly tech savvy, you want to know that technology is going to have a long-term impact on them. That you're not going to just give them this, the insurance is not going to pay for it, and then it's going to be stopped being worn within a couple of months, which is what tends to happen. And so we've completely solved for that with Health Tag. The second part of it is obviously the accuracy of the data. And I'll mention to you a couple of different studies. The first thing is around the actual data that comes off of it. We've got peer-reviewed studies out there and some more things that we'll announce in a bit around comparing our devices to the gold standard. So on the respiratory side, we're comparing it to flow meters. Obviously, the gold standard for respiration is literally measuring the air that flows in and out of your mouth. And we're comparing it to that. And across any number of activities, walking, standing, running, sitting down, whatever, we are 93 to 98% accuracy. as a reference, in-hospital devices are plus or minus 10%. So this is well within the gold standard from that. We are missing slides here. Is there another slide in there? Well, OK, I'm just going to talk to it. We are about to publish a study. It's not published yet, but I'll tell you it, on sleep. We're able to get very, very accurate sleep tracking, sleep data, because of the respiratory data that we have. So if you want to look at various aspects of sleep, both sleep quality, sleep and awake, TST, time to sleep, as well as obviously certain sleep conditions like sleep apnea, breathing is a fantastic signal to look at. And we're able to get that off of sleep too. We'll be publishing that shortly. I thought I had a slide on that. As well as just published, which I also thought was a slide, was a study looking at the feedback these devices can do that Stanford University ran with employees at LinkedIn, where we're able to show that the kind of feedback that we're able to get off these devices, the respiratory feedback, was able to lower significantly, statistically meaningfully lower perceived stress and stress and anxiety as measured on the MASQ score, which we're really excited about. The last one I'll tell you is we're also running a number of other studies. It was just announced that BARDA, which is a division of Health and Human Services, the federal government, is running a very large-scale influenza study to use our device to predict the spread of the flu, as well as we're running studies on COPD and other things. The point is, kind of lose some slides here, but the point is that once we make these devices disappear, where you can be the federal government and get people to consent in, obviously, to study where just stick this on your clothing and we're going to see if this flu is spreading. Or you can be an elderly COPD patient, stick these on, never think about it, and now a doctor can see whether the impact this is having, or whether it's someone who's dealing with stress or anxiety and having these on and having the feedback that this provides without having to think about it. We're really able to have an impact on patients. And for the first time, and what we're so excited about, is we can actually work with the healthcare system to deploy these because there's reimbursement codes. So if you haven't seen these, if you're in this space, I strongly suggest checking out these reimbursement codes because it's going to transform the business that we have. And finally, I'll just say one thing. I've got 2 minutes here, but I can stop a little early. We've had a number of people that were here that were interested in getting some of the health tags, the consumer version of it. My colleague, Mihao, who's maybe back there. Anyhow, he's got a table just outside. We've got a handful of them on premise that if you're interested, talk to him and we can get to you. So yes, someone's got one right there. Great, thank you. So he's just out there. You can check it out. You can touch them. You can feel them for yourself. We've got the person with their underwear out there because that's where our devices go, which is noticeable. Anyhow, thank you very much.
So